This is The Common Health from the CSIS Bipartisan Alliance for Global Health Security, engaging senior leaders on questions of how to address our common health security challenges in this post-COVID moment. I'm delighted to be joined again today by a close friend and someone widely admired in the field of health security and university leadership, Dr. Jeffrey Gold. Jeff, thank you so much for making time to be with us.
Always a pleasure to join you.
Jeff is the president of the University of Nebraska System, a $6.4 billion annual operation, 50,000 students, 52,000 jobs, a major driver of the economy of Nebraska in many, many ways. I wanted to open today by asking you to speak a bit about recent testimony that you provided up on Capitol Hill. This would have been March 12th, where you testified before the House Committee on Veteran Affairs, its subcommittee on health. This was with respect to a particular bill, H.R. 217, the Chip In for Vets Act that Congressman Don Bacon's co-sponsored. You came forward to talk about some of the work that's underway under your leadership in the University of Nebraska System in trying to push forward big partnerships into the future with the Department of Veterans Affairs. Tell us a little bit about all of this.
Sure. Well, I was really honored to be asked to testify before the House VA Committee and to talk both about the experiences that we had in the original version of the Chip In for Vets bill, which allowed a public-private partnership to build an amazing clinic, outpatient ambulatory surgery center for veterans in our community. This allowed a small private 501c3 corporation to take leadership to build a beautiful clinic, very functional clinic on VA property as a result of a large public-private partnership. Indeed, this original project was estimated by the VA to cost about $136 million, and through a combination of value engineering and local philanthropic support, the total cost to the VA was $56 million. So that is to say, we saved the VA tens of millions of dollars and delivered the project ahead of schedule and right on budget. And at the moment, the challenge and the opportunity for which I had a chance to testify on the 11th was the VA here needs to replace their 1950 hospital, which is in need of upgrading and what I would call a forklift renovation, meaning to be replaced. And what we proposed is using the Chip In for Veterans Act as modified by Congressman Bacon, H.R. 217, to replace that facility on the University Medical Center campus so that we could again save the VA a lot of money and accelerate the project. So just to give your audience a little bit of a flavor for it, on the VA project replacement list, this is now a 2029 project estimated at $1.56 billion to be done. We are estimating, in combination with our local VA colleagues here, that if we did this on the university campus, and if we did it in a way that we shared operating rooms, cath labs, endoscopy suites, and things of that nature, we could probably save the VA $500 million or more. And by the way, accelerate the project through this large public-private partnership, engaging the philanthropic community as well as, taxpayer dollars from the VA. So very exciting, warmly embraced by the subcommittee, and hopefully H.R. 217 will move forward, and that will stimulate the VA administrative team and their capital projects group and stimulate our philanthropic community to move ahead and build this in the near future in a way that will, do what we need to do to support those individuals who have worn the cloth of our nation and have protected our freedom.
Thank you. Now, you served for, I think it was a decade as chancellor of the University of Nebraska Medical Center, and you've served as board chair of Nebraska Medicine. So you've been at the helm here of a major complex of unusual medical capabilities. Does that give you then the leg up here in making your case to the VA, to the Department of Veteran Affairs?
Well, certainly, having been a practicing clinician, I'm a recovering cardiac surgeon, as I know you know, from the East Coast, trained in the Harvard system many, many years ago, sort of back when the dinosaurs ruled the earth. I think my background in the trenches, healthcare, dealing with patients and families, being a longtime federally funded research scientist, and having had a lot of leadership opportunity at both the board level and at the administrative level, I think does provide some street cred in these types of discussions. But at the end of the day, what we need to do is deliver on what we propose. And the thing I love about our university system is we have a very clear philosophy is that over-deliver ahead of schedule, favorable to budget, under budget. And that's been true for billions of dollars of capital partnerships that we've done in our community and continue to do. And it's exactly that type of model that we are proposing for the VA to embrace. And I'm excited and I'm actually optimistic about it.
Thank you. Now, in your testimony on the biannual budget before the legislature in Nebraska and some of your other remarks, you've made clear that this could be a difficult year. There's proposed state cuts of 2% in the university system budget. You've got a lot of uncertainty around the federal piece of this and may result in some difficult choices. I wanted to ask you your reflections on what it's meant. We're now in week 8 of the Trump administration, and there's been a series of executive orders. There's been a number of different funding spigots and programs suspended. There's been various on and off forms of layoffs. It's dramatically changed the environment in which American universities operate. Big focus on DEI, changes in the funding of biomedical research. I know the proposal for limiting the indirect cost of 15% had an immediate consequence for the University of Nebraska of something on the order of $27 million. There's been a lot of action in the courts on all of these matters, including allegations or investigations of anti-Semitism, proposals to raise the taxation on university endowments. That's particularly with reference to private, but not exclusively. Public universities are part of that same conversation. Can you just share with us your overview of how these changes are impacting the University of Nebraska system and what the implications might be for the future and your specific role as president of the system?
Sure. Well, it's certainly been a very day-by-day, week-by-week course adjustment for us. I think the way that I would frame it is that large universities and university systems across the country are used to change. We're used to change because not only do we see administrative change in Washington every 4 to 8 years, we're used to change in state legislatures, we're used to change in the office of the executives, meaning the governors. And while the changes may not be necessarily abrupt and they may not be apparent to all, these changes are endless. And in my decades of leadership roles in public universities and service in private hospital systems and academic medical centers, we've seen the ramifications of these changes when the budgets are good, when the budgets are bad, the effects of so many different type of ideologic changes that have occurred as well. And the role of leadership, certainly in my role and my appreciation for it, is to, one, of course, be a very good listener and learner as to what's going on across the country real time. So at least we have a full set of knowledge as best as we can, to be very careful not to read intent into anything, but to just be very pragmatic about what changes are going on and then be responsive as to be sure that we are, one, a law-abiding organization, which we have been and continue to be. I'm sure that is true widely across the country. No one is going to intentionally go in a different direction, at least certainly not in our institution, but also be very pragmatic about the financial implications of this. And as you mentioned, the potential cuts in indirect cost recovery, F&A as it's sometimes known, a sort of on again, off again. As you may know, there was a temporary restraining order, and now there's a formal injunction that has stopped that. As I've determined through our business and finance folks, those funds are continually being drawn down, as they have been in the past, at the full F&A rate for our institution, which in some ways, obviously is good news, but in some ways creates a lot of uncertainty, because if we thought there was a $10, $20, $30, $50 million cut in any aspect of our revenue, we would have to plan and then make some changes. And if the changes are on again and off again at the, discretion of the courts, which have a very, very variable timeline. Some of these things can occur in days and weeks, but others may occur in months and years. It's going to be difficult to make some of these decisions. So, our approach has been pretty simple, and that is for those things we're relatively sure of, when, for instance, we have about somewhere between $10 and $12 million of federal grant funding that has been cut. We've been told that those programs are ended. Many of them are USAID work that we do through an institute called the Doherty Water for Food Institute, which does work on irrigation for developing countries to try to make those countries more food and safe water sufficient. Those dollars, that particular piece, just one of them by example, was a $19.6 million 5-year grant to us, contract. And unfortunately, we need to make some hard decisions as to what to do with the staff that we hired to reach out to do that. Now, one of the unfortunate consequences of that as well is part of that grant actually supports the farmers and ranchers here in the state of Nebraska as to some of the research that's going on with what's called advanced central pivot irrigation and things, a kid who grew up in New York should probably know nothing about. But believe me, you learn pretty quick when you live in the great state of Nebraska what really matters. And so we're trying to just be as reasonably responsive and thoughtful and to be as, frankly, as caring as we can about some of these decisions. A lot of these people who work for us, talk about water for food, come to us from all across the country and around the world. They move their families here. They enroll their children in our schools. And if we're going to have to make a decision to reduce that workforce, we have to do it in a way that is thoughtful and as considerate and as respectful of those individuals and their families as possible. And so, coming back to your earlier introductory comment, a lot of the stress, if there is stress, and I don't know if I would call it stress, but a lot of the anxiety of the perceptions really relate to the rate of change, the pace of change. Most institutions of higher education, large academic medical centers, are fairly used to having some runway of opportunity to implement strategic change, to look at where the opportunities are, to turn challenge into an opportunity. That has sort of thematically been one of the cores of my leadership journey, is to every time we see a challenge to try to turn it into an opportunity, sort of lemons to lemonade kind of theory. And a lot of that requires a bit of time, not a huge amount of time, but a bit of time to carefully think through what those opportunities might look like, how people and roles could be repurposed in ways that would be effective and sustainable. And so the constant rate of changes, notifications, letters, which typically occur, at 5 p.m. on Friday evening, sometimes have made that somewhat more difficult. But I'll tell you, as I crisscross our state and meet with our farmers and ranchers, meet with our, clinical arm, which is a large, multi-billion-dollar enterprise, the core mission has not changed. People are still rolling up their sleeves, working hard to do their very best to make sure that our university and our university system is as successful as possible. That's what I've told people over and over again is do your job. Do it as well as you can do it. Make sure that you're proud of what you do and that the people that we serve are proud of what we do, and we'll work on dealing with the rest.
I would think that, and this picks up on one of your remarks about the speed in which these changes have been introduced and the number of fronts on which this blizzard of action has unfolded, poses a pretty extraordinary challenge in just managing this and understanding and digesting what's going on. The contestation in the courts, there's over 120 lawsuits that are underway right now. Not all focused on universities, focused on all sorts of things. Mm-hmm. But it's just trying to understand this environment is a great challenge. And you have, as a great research university, you've got complicated relationships with NIH, Department of Defense, Veterans Affairs, Department of Education, Small Business Association. All of these partners are part of the fabric of the university, and they're all going through very significant changes that remain somewhat volatile and uncertain. Just say a bit about how this changes your job.
Well, and I might add to that list, Steve, we are closely connected to the agricultural sector in Nebraska, which is the largest part of our economy, whether it's row crops or protein production. And so market prices for corn and soybeans and pork bellies are critically important to us because they feed the economic infrastructure. And so communication with all of those key stakeholders on the federal and on the state level are very, very important right now. And as corn prices and other ag commodities have gone down recently, that really jeopardizes the economy on a year-by-year basis of the state and those states that are involved in the, production of food product. And it's very important for us to preserve and protect that. And so I'm out every day, literally 7 days a week, meeting with different groups where they want to know what the university is doing and how we are responding because, at the end of the day, we are the largest employer in the state of Nebraska, certainly between our healthcare systems and the core university campuses, 4 of them across the state. I mean, we're about 8.5% to 9% of the gross domestic product of the state of Nebraska. And if you look at that per capita, that is the largest percentage of the GDP of any state in the United States. So we're not just responsible for building the future workforce and educating the next generation, all of the research, science, and discovery, which extramurally funded research last year was approximately $700 million. I mean, certainly not as big as some of the East Coast and West Coast institutions, but for a, Midwestern institution, that's still a lot of jobs, a lot of work, a lot of critically important research. At the same time, we have got to maintain our role as a very, very significant economic pillar of the state. I mean, we are the largest growing. If you look at the industry wide for the large industries of the state, our economic impact, in spite of everything related to the pandemic, went up $1.6 billion over the last 3 years. I mean, that growth in terms of, dollars brought into the state economy is critical to maintain the, financial and economic stability of the state.
I was glad you brought up the centrality of the agricultural economy. When you look at Nebraska, it's overwhelmingly dependent for sales of its soy, its corn, its cattle to the Canadian market, the Mexican market, the Chinese market. These account for the vast majority of the exports.
And we are one of the largest exporters of those commodities in the country.
And back in 2019, when there were tariffs imposed on China and elsewhere, it put at risk the farming community in Nebraska at about $1 billion of lost market. Some of that was compensated at the end of the first Trump term with cash bailouts for the, subsidies for the farming community to keep them afloat, keep them solid. But some of the markets were in the process lost. In other words, Argentina and Brazil captured some of those markets from Nebraska, markets sales to China in particular. Now we have 25% tariffs on and off on Mexico, Canada, initially on China 10%, now 20%. So this must be creating quite a bit of uncertainty and anxiety within Nebraska about sustaining that engine of growth.
It's hard for me to know in my role as the university president, what I would call the dynamics of that. I think there is an expectation or at least an anticipation that there'll be some federal way that the farmers and ranchers can be kept whole if that were to become a reality. But at the end of the day, it is critically important to us as a university, even though, of course, we don't trade in commodities, but anything that supports the economy of the state, and particularly our primary source of revenue, the ag sector, has got to be good for the university and for the rest of the state. It's sort of like, all of us think about in our personal finances, diversification of our investments is the name of the game. And we want to be sure that we have as much diversification as possible, particularly when there's change in different markets. And so given the fact that we're so heavily involved in the ag sector, anything that would impede commodity prices and the ability of our farmers and ranchers in rural Nebraska to be successful certainly puts much of the state and the university at risk. Similarly, if something happens to the stability of the economy of the university, if something were to happen to our research sector, for instance, in way we transfer intellectual property and commercialize, discoveries and patents and things of that nature, that also would have a significant impact on the state. We have a very substantial banking and insurance industry here. We have a fairly robust technology industry here. We call ourselves the Silicon Prairie in many ways. And yeah, you've been here, so you know it's very much a prairie in important ways. But at the end of the day, all of these pieces of the economic stability of the community, which of course translates directly into the quality of life, is critically important.
Let me shift the conversation a bit to talk about the cable program, Rural Health Matters, that you've spearheaded. I've had the great pleasure of joining with you on, I think, 3 of those segments. It's a weekly 1-hour show that reaches 15 to 20 million rural farming and ranching families across the country. Say a bit, if you would, about the trajectory of issues, particularly with respect to H5N1, measles outbreaks, the high hospitalization rates for seasonal flu. What's the trend line now? Every week you engage with this audience. You started with COVID remains a big central concern, reminding people that it's still with us and we still have infection rates and the need for vaccinations and we still have hospitalizations. Just tell us a bit about where are we in that work that you do, that you continue to do. I don't know where you find the time to do this, but you do.
Well, I really enjoy it. And so we're in our 9th year now of weekly live Monday night broadcasts on RFD TV, which is a cable network that predominantly serves much of rural America, literally coast to coast. And we've had the opportunity, of course, to have you as a guest several times and many others. And the basic premise of the broadcast is the cable network doesn't tell us what content we can or cannot have. They don't pay us. We don't pay them. We produce the show. They provide the technical aspects for it. And we and I very much get a chance to select the guests and to work through what's called the run of show. And generally the way it works is in a 60-minute show, there are 3 blocks. The first block is just updates, whether it's on COVID, flu, measles, Ebola, whatever is going on, Marburg. Last night we talked about Lassa fever. Always just an update on what rural America might be wanting to know. We also talked a good deal about childhood cancer and the demographics of that and early warning signs of it. Reason being, of course, is that childhood cancer seems to have a significantly higher case fatality rate in rural communities than it does in urban communities. Although childhood cancer is relatively rare compared to adult cancers, the mortality rates are about 9 or 10% higher in rural America, even when you adjust for age, for socioeconomics, for disease diagnosis, etc. And so, the job of this broadcast, and the way I see it, is just to create awareness. So a few weeks ago, we had a guest that we spoke specifically about measles and the history of measles and what is available and can be done through vaccination. We've talked a good deal, things that are of interest and importance to farmers and ranchers, sun damage to their skin and skin cancer. Talked a lot about dusts and inhalants and pollution. During the planting season and during the harvest seasons, we talk a lot about farm safety and major equipment. As I've come to learn, again, as a kid who grew up in the inner city of New York, that farming and ranching is not a very safe business. Farm accidents and farm deaths are very high in this country. And anything that we can do through this broadcast to create awareness. And, and one of the fundamental principles of the broadcast, just to be really clear, is that there is no politics involved in it. As you know, from the times that you've been so willing to join us, we just stay totally fact-based. I mean, what does the science say? And when the science changes, we reflect that in the information we share with our audience. But the interesting part about the show, Steve, is that in the third block, the third 20-minute segment, we take live audience questions from across the country. Anything and everything, like last night there was a question of H5N1 in cat food.
Right.
And, how does that happen? What are the regulatory checklists that can prevent that kind of thing from happening? And does it put people at risk? And as you may know, there have been a number of reports of domesticated cats that have been diagnosed with, high-path avian flu recently, and yet another set of mammalian transmissions from the avian communities.
Thank you. We've got a few more minutes left. I want to put a closing question to you. People who work on health security, on preparations for biothreats, on preparations for natural disasters, are oftentimes making an argument that in this current time that we're in, that we're going to see ever greater responsibility for managing health security challenges and natural disasters falling on states and localities of the country, that there's going to be a push towards greater reliance and greater responsibility at those levels. What do you think about that proposition? You think that's true?
Well, I don't know whether it's going to be pushed to states or local municipalities, but I do know this, that the more the states cooperate with each other, share active information, and can see trends occurring not only in the United States, but around the world, the safer we're going to be as a nation. I'm all for building local resources and capabilities, responsiveness. I think in many ways, the COVID pandemic found us as a nation relatively flat-footed in terms of the responsiveness. And I don't mean that federally, locally, or, at the state level, but I just mean in aggregate. We rallied quickly. We did what Americans do well, which is roll up our sleeves and work together, and had, clearly one of the lower case fatality rates in the country. And by the way, Nebraska had either the lowest or one of the lowest case fatality rates in the country, which I'm really proud of because of our in-state communication systems and network and proactive treatment and vaccination programs. But at the end of the day, the more that we can work together, effectively communicate, make sure that there are resources where they're needed, make sure there's active scientifically based information in a timely fashion, the better we're going to be able to deal with any of these future challenges.
Thank you. We always close by asking our guests to tell us what gives you greatest optimism and hope right now. Your thoughts on that, Jeff?
I'm a very big fan of the future of higher education. There is little else that gives me as much optimism in the ability to create social mobility, to uplift people from poverty, and to create the quality of life that we all want for ourselves, our children, and our grandchildren. And I've never been more optimistic about the fact that that is still core to the future of this great country.
Thank you so much, Jeff, for making time to be with us today and for all you do. This has been a great honor to have you with us today. Thank you for listening to The Common Health. If you enjoyed this podcast, please give us a follow and leave a review. To learn more about the CSIS Bipartisan Alliance for Global Health Security or listen to other CSIS podcasts, please visit csis.org.